I realize it's a very big step for patients to take, to make a decision to come see somebody like myself, a reproductive specialist, to help address this very significant issue in their life, which is their ability to create a family. And there's a lot of anxiety involved in coming to an office like mine to be able to start initiating that process. And so I really wanted to give you some idea of what it's like to go through a consultation, in particular a consultation here with me at Huntington Reproductive Center. And so, you know, before you come to the consultation, if you've had other diagnostic procedures, any treatments done, it's really nice to be able to get those records together, to have those available to me ahead of time so I can take a look at those and review them to put that in context of what we're going to talk about during your consultation. Now when you come to see me, we're going to have you in a hopefully nice relaxed atmosphere, and so what we're going to talk about is really initially your medical history. I'm going to take a very thorough history about just things that have happened to you medically in the past, illnesses, surgeries, you know, allergies to medications, those kind of things. Just take a very thorough inventory of things that have happened with you medically in the past, but also included in that, discussing fertility things you've been through before, again, diagnostic studies and treatment procedures. And so we'll put that into context. Then what I want to do with you is take a significant amount of time to educate you about the fertility process. And I always try to go through with my patients 5 factors that affect their fertility, because by going through those common factors, it sort of demystifies the process and gives them a better understanding of what diagnostic studies we should do and why, and what treatments will result as a consequence of those diagnostic procedures. And so the 5 factors are talking about male factor, the sperm quality, talking about what we call uterine factor, how healthy is the uterus and can it carry a pregnancy appropriately. Are the fallopian tubes working okay? Tubal factor in fertility. There's something we call pelvic factor, which is basically, is there any scar tissue inside a woman's pelvis, which comes as a consequence primarily of surgeries or infections? Are things working well inside? And finally, I like women to be ovulating consistently and consistently ovulating good quality eggs, ovulatory or ovarian factor in fertility. So we talk about each of those factors, how it relates to the information that I've gained from you, and then based on that, what are the potential diagnostic procedures that we could do to move forward, trying to find more about what the causes of your problem are. Following all this conversation we have, we then want to go do a very thorough physical examination. And it's very important, if you go to a fertility consultation, it must include a physical exam to be a thorough visit, because a lot of information is achieved from taking a look at your uterus and taking a look at your ovaries. So part of our exam includes a general physical, including a pelvic ultrasound. All fertility evaluations must include that to be a thorough evaluation. There's a lot of information we gain from looking with an ultrasound about what the potential factors are that are affecting your chance of conceiving. Following a medical history, a physical examination, we then again sit down and put all those pieces of information together and decide where it is that we go from there. And so for me personally, it takes me about an hour, hour and 15 minutes to be able to achieve all that. And so I want to make sure that when my patients leave here, they have a very thorough understanding of what their issues are and where it is that we can go from there. And so to me, wherever you go for a consultation, it should include those components, and someone should be able to spend an adequate amount of time with you to make sure all your questions are answered.